Okay, I have major updates in the Rachel Tussey case, the woman who had the mommy makeover and documented it and sadly passed away a few days ago afterwards. Today, her surgeon held a press conference with his attorney where they revealed they're suing the surgery center and the anesthesiology group that took care of Rachel. He said during the 9-hour surgery there were no complications, and he actually went into details on how much was given by the anesthesia provider and how much was given after.
The level of speed of narcotics administered during Rachel's recovery were extraordinary and dangerous. During her entire 9-hour surgery, Rachel only received 100 micrograms of fentanyl and 0.5 milligrams of Dilaudid over 9 hours. In recovery, she was given 150 micrograms of fentanyl and the same amount of Dilaudid in just minutes.
Then he goes on to discuss what I think is the biggest bombshell of the whole thing.
To be clear, hospital testing has confirmed that Rachel did not suffer a pulmonary embolism or fat embolism. Her respiratory failure was a direct result of narcotic overadministration during her immediate recovery period.
The press conference was actually pretty long, but he goes on to say that he felt the anesthesiologist should have been there, and it was her responsibility to be there in the immediate post-operative recovery area. He was actually gone and got the phone call when it happened, and he said he was only 2 to 3 miles away, and he made it back before EMS did. So this was pretty shortly after the surgery is what it sounds like. I pulled this directly from the American Society of Anesthesiologists.
There are new updates regarding Rachel Tussey. This is a patient who underwent a mommy makeover and then tragically passed away afterwards. And this case has been haunting for plastic surgeons and patients alike, and I've been following it closely to help understand exactly what happened. The update that happened today is that Dr. Tork, who is a really well-respected and board-certified plastic surgeon, is actually filing a lawsuit against his surgery center where his patient passed away. This is pretty unorthodox in our field, and the reasons he is filing a lawsuit are alleging that the patient was administered a very high dose of fentanyl in combination with Dilaudid, and that ultimately led to her anoxic brain injury and loss of life. The other disturbing details that are included in the allegations are that the surgery center subsequently was purging medical records and altering her chart to diminish or hide her actual cause of death reason, given how much public attention the case got. As a plastic surgeon, I really hope that that is not the case, because that is disturbing on so many different levels, but I will be following this closely, and I hope that the truth does come out for Rachel and her family. And I just want to also extend my condolences to all of her family and loved one for her loss of life. I hope that we get understanding on why she passed away.
Okay, here it is. It's my turn.
Rachel Tussey recorded this TikTok right before her tummy tuck operation on February 25th, 2026. She had been documenting her journey online in the weeks leading up to the operation.
I feel a big range of emotions, but mostly it is absolutely excitement and gratitude.
Nearly 3 weeks after her operation, Tussey died in hospice care due to an alleged opioid overdose she received after surgery, according to a new lawsuit filed by her surgeon, Dr. Shahryar Tork.
Rachel's death was completely unnecessary.
The 32-page lawsuit claims that Journey Light's unqualified post-anesthesia care unit nurse administered an opioid overdose, resulting in Mrs. Tussey's death. Tork also named Associated Anesthesiologist of Springfield as a defendant.
This was not a tummy tuck complication. I would be seeing her smiling in my office if other people had done their job.
According to the lawsuit, during Tussey's 9-hour-long surgery, she was given 100 micrograms of fentanyl and 0.5 milligrams of Dilaudid, adding that Tussey had a low tolerance for opioids, something she expressed concern over on TikTok.
I'm nervous, too. I don't like pain medicine.
The lawsuit states that just after Dr. Tork left, Journey Light gave Tussey another 150 micrograms of fentanyl and 0.5 milligrams of Dilaudid within minutes.
This caused her to lose consciousness and sustain an anoxic brain injury due to a prolonged lack of oxygen.
Tussey died 3 weeks later. The lawsuit also claims that Journey Light altered Tussey's medical chart and forms to, quote, cover up their role in her death.